So this is for discussion 4. For the first question, I think alternative spiritual interventions should be readily accessible in hospitals and other inpatient healthcare settings. I think that if we use spiritual interventions in conjunction with our traditional therapies, that we could achieve better outcomes for our patients. In the video about the ER in New Jersey, one of the doctors mentioned that their hospital is not opioid-free, which I think is important to remember. So they try alternative therapies first, and then if those don't work, an opioid is their last resort for pain for their patients. So I think it would be worth a shot to try the less harmful alternative therapies first, and if that works, that's great, because we've accomplished one of our goals as healthcare providers, because we've addressed the pain of our patient and we've eliminated the unnecessary risk of possible addiction associated with opioids. In the article about UK's integrative medicine program, they mentioned several complementary alternative medicine approaches that can improve the overall health and well-being of our patients. Similar to Puchalski and Farrell, they emphasize the connection between mind and body, and that can help reduce stress, alleviate pain, strengthen immunity, and give one a sense of hope and meaning in their life. And what I think is great about this program is that as healthcare providers, we're always telling our patients to adopt a more healthy lifestyle. And all of these different alternative therapies are ways that they can do that. In addition, these practices can help prevent diseases as well as treat diseases that our patients are already diagnosed with, such as like inflammatory conditions like diabetes or hypertension. And in the book, Puchalski and Farrell mentioned that mind-body interventions have evidence of positively affecting the body's physiologic processes, including cardiovascular system, neuroendocrine function, and immunity. As well as the effects on the body, they have good effects on the person in their abilities to heal and cope with life, as well as finding meaning and hope in their lives. So there are so many benefits to these therapies that I think patients should be made aware of them and be able to have access to these. And for the second question, according to the authors, determining when a patient needs a referral for a spiritual counselor depends completely on the patient and on the needs of goals of that patient and the needs and goals of their caregiver. Puchalski and Farrell mentioned that a referral to a spiritual counselor can be made in both crisis and non-crisis situations. And the crisis situations include situations such as a life-threatening illness or something that causes the patient to think about the really big questions in life, the ones that the authors describe as central to human existence, such as what happens when I die, or why is this happening to me? And so these patients are in spiritual distress, and so referral for a spiritual counselor is definitely appropriate in these situations. And the non-crisis situations include something where the patient isn't necessarily in spiritual distress, but they are worried about their spirituality because of their beliefs. And the authors gave the example of the young man who was diagnosed with a brain tumor, and he was worried because he had left the Catholic Church, and his family had been members of the Catholic Church for 3 generations, and so him leaving caused conflict and tension between him and his family. So the spiritual counselor being brought in and giving him support helped him feel at peace with his diagnosis and with his beliefs during that incredibly stressful time. So in both these types of situations, a spiritual counselor would be necessary and appropriate.